Hi, nice to see you. I'm Gina Still.
Really nice to see you.
Nice to see you. Nice to see you. Nice to see you. Hi.
Hi, Gabriella.
Nice to see you.
Big bag. I want to make sure I have a pen for someone.
You got you covered if you don't.
Oh yeah, we have a few thousand though.
They're the good ones.
Yeah, that's great.
Right, taking one.
So I know you guys all know each other, but let's just go around the room one more time just so I can make sure I've got everybody's role down. I know all of you, yeah.
Sure. Mary Forsyth Tabor, Executive Director for Making It Happen.
Right.
We also represent the Greater Manchester Region Public Health Network.
Yeah, great, thanks.
Hi, Gabriella Straube, Associate Director at Hope on Avon Hill in Rochester.
Thank you.
Danny Gamesso, I'm the Director of the Child and Adolescent Department of Mental Health Center, Greater Manchester.
Terrific, thank you.
I'm Michelle Lennon, President and CEO of RTs. We have the Family Resource Centers and Recovery Centers in Sloan, Franklin, Plymouth, and Concord.
Yeah, great, thank you.
Gina Still, the Chief Operating Officer of the Mental Health Center of Greater Manchester.
Thank you. You know, thank you for hosting and making it happen, but also for the work you guys do is so important. And one of the reasons I'm here is to focus on the progress we've made in combating the opioid, particularly the fentanyl crisis, but also the work we still need to do. Because you all have been such effective advocates, and it's been people from every part of the state, every walk of life, who have really wanted us to come together and find a way forward as we're dealing with a level of, well, the type of epidemic that is unique to fentanyl. You know, there have been drug epidemics before, there have been other illicit drugs. Heroin was obviously a problem. Fentanyl has just taken that to a level that has made it particularly hard for us to combat. But we have made progress, and we've made progress for a number of reasons. I want to hear a little bit more about some of the ways that we've all learned to combat this epidemic and addiction more generally. It's not just about fentanyl, obviously, but fentanyl is one of the more lethal things that we're dealing with at a very, very high volume. But one of the things that I wanted to focus on, we've seen nationally now in the last year about a 27% reduction in opioid overdoses, which is one of the first really pieces of positive news I feel like I've gotten statistically since I started working on this back to my days as governor. I've obviously heard many individual stories of success because of people's hard work, because of the resources we've been able to put together. But one of the things I wanted to check in with all of you about is kind of what we have learned about what works and the work we still need to do. As you all know, one of the reasons we've had more resources in New Hampshire in recent years to help us combat the epidemic is because back in 2018 we passed the Bipartisan Support Act. President Trump signed it into law, and that began to give us some critical tools for our first responders. It gave us some important tools to help recruit people into the field of recovery, public health and medicine, and it helped us with particular populations who were impacted, including pregnant and parenting women. But that Support Act, which authorized the spending for all of these resources, actually expired last year. And while some of the money still went out, a number of us in Congress got concerned that if we didn't reauthorize it, we could see people arguing that the resources couldn't get out to the communities. So one of the good pieces of news in the last week is that through a bipartisan agreement, we were able to pass it unanimously in the Senate, which was a really good thing, and it was really nice to stand with one of my Republican colleagues and be on the Senate floor and both of us talk about the impact, the positive impact the Support Act has had on our constituents. It was Bill Cassidy from Louisiana and me, and two very different states, but two very similar stories in terms of the fact that we had made some progress. And I think the thing that I am focused on right now is we're seeing real evidence of progress. I think we're beginning to see some light at the end of the tunnel in terms of having tools and knowing how to use them in combating addiction generally, this epidemic in particular. But in order to get to that other end of the tunnel, we have work to do still. And so we've reauthorized the Support Act. We'll also have to push and advocate for the funds to actually be appropriated and get out the door in future years. But I just wanted to check in with all of you at a moment where we've seen the reauthorization. We now have the legal authorization to appropriate more money for critical resources. But I'd like to know kind of what we've learned since 2018, or you don't have to be exact on dates, and what you're hearing from the people you work with, and what we still need to do. So that's kind of how I wanted to kind of set the parameters for today, but I'm also just interested in anything else y'all want to tell me too. So, and I don't know, Mary, if you want to go first, or you don't have to. Yeah, either you guys can do this in any. Yeah, I really just wanted to kind of kick it off that way and then just have a discussion.
So I'll start. So Making It Happen is really a support agency to a lot of the agencies within the greater Manchester that actually has direct funding. And I think that's really important because we are more community facing and across the board at prevention, treatment, and recovery.
Right.
We have two monthly coalitions, collaboratives. One is the Recovery Ready Communities, which is 18 and older providers coming together, and then our Youth Wellness and Prevention, which is fairly new, it's in its second year, which is 18 and under, and it's really bringing about 25 to 35 youth-serving organizations together. So we're on the prevention end, right? We're trying to get not only the students, but the parents and the caregivers information, as our signs out there say, engage, educate, and empower them to live healthier, thriving lives. And the one critical thing that we're doing is making sure that they understand the resources that are available.
Yeah.
So it's kind of a moving target right here in Manchester region because we have a new doorway facility now. We have a new campaign coming out of the Strongest Granite. We have the 988, which, believe it or not, after 3-4 years, people still don't know what that is. So that's the education that we're doing, and then supporting bigger grants like the LEA has, or Amsgate Health has, or the school district has, and filling in those pieces. And I think that's a critical piece. While you guys are all doing the really critical work, we're doing that critical work, which is helping the community understand what's going on and how to get connected to resources, and that there are things happening, because everyone that's got the grants directly and is working really hard, they're working on that problem, and they're not putting their heads up and saying, look at us, we're doing all this great stuff. We can do that for them.
Yeah, well, that's right.
And specifically, we have some opioid abatement funding that we're working in collaboration with the health department, with the outreach teams, with the health department, the police department, the fire department, and the doorway, making sure that they get the trainings that they need, and they also get the Narcan kits, which we have out in the lobby, which I can show you later.
Yeah.
So that's kind of how we're contributing to this.
Yeah.
And then if we, in those two collaboratives, we hear any spikes in anything, especially at 18 and under, if there's something going on, we try to either address it ourselves or get that information to the right partners.
So really a convener and an explainer in lots of ways.
That's our role.
For those that don't know, Hope on Haven Hill is a substance use treatment facility for women we service the whole state of New Hampshire. But we do have 2 specialty programs for pregnant and parenting women that are residential programs. And so something that we've learned since 2018 and something that we've tried to really bring to our programs is this integrated health care, that we are a one-stop shop for our women to receive primary care, medicated assisted treatment, and because of this initiative being pushed through, we were able to expand and offer medicated assisted treatment of the Suboxone, the Vivitrol, the naloxone, all on site, because we know one of my coworkers coined the term the hot potato healthcare of, especially with pregnant and parenting women, is it the OBGYN that takes care of the mom? Is it the pediatrician that sees the kid? And so being able to have one spot, one area for our women to go to receive substance use treatment, to receive childcare, to receive all of these services has really helped reduce some of our women being lost in the mix here. And so that is something that has been really instrumental in us helping and seeing through from when a mom calls in to do a phone screen or an assessment to then when they reunify with their children and get housing, kind of towards the end of their journey with us. But another thing as well, you mentioned the opioid abatement funding, is that we recently received some of that funding and were able to open a partial hospitalization program with expanded housing. That will soon be called high intensity outpatient treatment, but we're able to roll that out, continue to add a level of care to our continuum of care that we offer, and hopefully support more women that have different needs. And so, we've really learned that that is an approach that we use to treat, this really disadvantaged population of just having a one-stop shop for when they come in and receive services.
And some of that work has been funded with grants through the Support Act, if I'm correct, right?
Yep, absolutely.
It's one of the concrete examples I try to use because I think, one of the challenges I have in DC is that there's a lot of different programs and a lot of different efforts going to a lot of different places about a lot of different things. And so people are always like, what's this about again? And when I can say, well, now in New Hampshire we have a one-stop shop for pregnant and parenting women who are fighting addiction. And that's because of this law we passed and these funds that flowed from it. It really does help people focus on, that particular need and challenge because, to your point, not that many OBGYNs know a whole lot about addiction. More and more of them probably do, but you still want really to have that one place where there's expertise.
Yeah, thank you so much over the years of the support through Hampshire and Carrie Sense for recovery.
Well, no, I mean, you guys have been doing great work, but that's also a reflection on needing to get resources to the front lines and then letting all of you figure out where the gaps are. And obviously there were a lot of gaps in addiction treatment, and there still are, but one of the things is we didn't really see it as an illness for a long time, right? Talk to me, or anybody else jump in, but yeah.
She's going to get along with you.
Yeah. Because you're both,
Came together, and I mean, Danny's the children's director, so.
That's what I thought, okay.
She's
I'm really glad you're here, this was a good addition.
She is the one that's implementing the funding that we received, but I wanted to start with a quote from you. Because you said, the opioid epidemic has ravaged families and communities. And I am at the end of my cold, I am not at the beginning.
It's all good.
And that just really resonated because we at the Mental Health Center of Greater Manchester we're providing the treatment to these children. And the Support Act, as you pointed out, has been able to deliver funds, and we're the recipient of a large grant to treat trauma for children. And countless times I've sat in admissions conferences and heard the stories of children that have lost one or two parents and more. Like, the trauma is vast. And so I can't tell you how much I appreciate that these funds also identify the children and their needs.
I still remember firefighters here in Manchester telling me that they had responded to an OD at an apartment. Walking through the apartment, the kids were, startled, worried, concerned. They rescued one of the parents from an overdose. I think it was a single parent. And then 2 weeks later, they were back there for the same thing, and the kids didn't move from the TV. And that just always struck me as, we have to be able to give people more tools than this, and we have to be able to give up kids something.
Very sad story. So the funding that we received through SAMHSA, we've been focused on our partnership with the Manchester School District in providing trauma treatment in the schools. So I'm very proud to say that to date, we're in our 4th year, we have 1 year left to go, but we've served approximately 450 students, trauma services, but specifically our partnership is a unique one where We're providing an evidence-based practice called Bounce Back, which is a trauma treatment that is specifically designed to be provided in a school district. So our overarching goal was to improve access to care and reduce barriers. We really wanted to create a system where kids that needed treatment could get in and get what they needed. So the school district was the obvious partner. And our clinicians partner with the social workers and they provide this group together. We also provide individual supports, and then for kids, you know, kind of the example that you gave that have more extensive trauma, we're able to connect them directly with more intensive services at the mental health center. And these funds, I think they do something that are incredibly special because most people that we see, we bill their insurance, they have to get in our door. You know, there's a lot of barriers for families that are working and trying to make ends meet and just, you know, get dinner on the table at 5 o'clock, where we can provide this service in the school that reduces a barrier, but also the parents don't need to try to figure out if they have a deductible or a copay or what funds they're gonna get to pull this together to be able to receive these services. Which, you know, sometimes half the battle that they're, you know, what am I gonna deal with today? And so this has been a game changer for these families. The kids love it. I mean, we hear like the cutest stories ever. Like, can we have group again? Which group? There's our next group.
Yeah, I'm sure.
Why is it over? And also, you know, insightful elements where the kids are like, I didn't, you know, realize that other kids have big problems like me. They don't discuss their specific trauma, but they do learn that they're not alone. So that's kind of like the goal, is to really help them gain the skills that they need to process the feelings that they're having, to be able to get back on track academically, so that, you know, they can be done with the group and then move on.
Right. Yeah.
And so,
and make sure that the part of their life that they have control over, they can be successful in, right?
yeah, absolutely. So these funds have been instrumental in those successes. We're in 5 schools.
Okay.
If funding continued, we would expand. Right. So that would be the goal. It's easy to say we would expand. There's so many complexities with, you know, workforce and other elements, but the schools, you know, I think they were a little hesitant at first. This is their plates are full. It's like Thanksgiving for them, and to add something else is like, oh geez. But they love it, and we feel confident that if future funds are secured, that we would be able to expand and continue to be successful. So really good. Yeah, we thank you.
Thank you. You want to add to that, or?
No,
Yes,
I think
just
she
in-
did a beautiful job.
No, that's great.
I wrote notes. I tried.
No, you did great. How's our choice going?
Oh, gosh, we're busy all the time. I just want to address the funds first, I think, because our situation is a little bit different. We have so many pieces of great funding.
Yeah.
You know, our backbone funding comes through the facilitating organization, Power Care, but everything is kind of pieced together.
Right.
But interestingly enough, you're talking about workforce for mental health. In our case, it was an individual participant who was addicted to heroin when we met her, experiencing homelessness. She had lost her children.
Yeah.
She was fortunate that they had been placed with a kinship caregiver.
Okay.
So this story like touches on like everything we do. So she entered coaching, and she ended up, you know, establishing recovery, initiating it. She then began as a volunteer doing table hosting for our recovery cafes that we run.
Yeah.
She then joined the AmeriCorps program with us.
Wow.
That was put out by Power Care. She was hired, she got her CRSW doing that, was hired. She went back to college, got her addiction counseling degree, a 2-year degree, went on to get her bachelor's degree in addiction studies. And she, at that time, wanted to go on for her master's degree for her LADAC, her licensed drug and alcohol counseling license. But $20,000 in debt from the initial schooling was the issue for her. So we had applied on her behalf for the debt forgiveness and got it. Mm-hmm. So that's what those were. Yeah. She went on to graduate from UNH with a master's in clinical social work and recently passed her LADAC counseling exam and is working for Aliyah Hospital now.
That's fabulous.
Yeah. So for us, like we recognize that the peer recovery support worker job or family support worker job, it's either going to be the calling that you stay with for your whole life,
Yeah.
or it's going to be a stepping stone to something higher if you have those goals. And
Right.
so for us, we invest heavily in our staff.
Yeah.
And so she was one of those that we did. So she, I wanted to let the aide know, because you asked, was this a tool for retention?
Yeah.
Yes and no,
Right.
because we actually contracted with her because she had the LADAC
Right.
to do work with us on a curriculum we were developing with UNH for
Yeah.
family support integration
Yeah.
with peer recovery support stuff. So that's our funding story. It's kind of limited to that,
but it's an example of what we were trying to get at, which is, how do you look at the continuum of somebody's experience with addiction, and how do you not only empower them, but understand that for some people, wanting to stay in the space, so to speak, of helping other people once you've gotten through it yourself, and then how do you actually practically make that work? And
it was a huge barrier.
it takes, the cost of education, the cost, a lot of basic costs are real barriers for people to not only get better, but then stay better, right, and build a life. And so I'm glad to
And
hear
she's
about
purchased, she actually bought a house that, like, when you think about from addicted to heroin, homeless, lost everything, to where she is today.
Yeah.
And like, we're celebrating our 10-year anniversary this year, and like, we're starting to see the fruit of the work we did 10 years ago now, and how the interventions really matter, really matter.
Well, I think that brings me kind of to the question of what have we learned as this terrible epidemic unfolded. In some ways, addictions to opioids is not new to humankind, obviously, but the capacity to produce fentanyl as opposed to grow poppies and then convert them into heroin sped things up, made it less expensive, made it much easier to smuggle. So it's a historic problem all of a sudden just ramped up and accelerated, and then you add to it the way OxyContin, among other things, was marketed and used, and some people say it was intentional, some people say it was just unintentional, but we ended up with a body of people with addiction who would not normally, were not the historic cohort, right? But now we are, 10 years plus into this, into an epidemic at this level, and we are learning strategies, whether it's actual treatment or whether it's prevention and recovery. We're learning about strategies that help, but I'd love to get your thoughts about what we've learned in terms of specifics that work or options that organizations need to have. That funding that says to somebody, you're covered.
Right.
You can participate, your child can participate in this, you don't have to worry about co-pays, whether it's, peer-to-peer support. I'm just, whether it's the integrated care or whether it's the bounce back program. But what do you think we need to know, both in terms of what's worked and also, what challenges we've had?
I was thinking, it's not the time to let up the gas.
Yeah.
Right.
That the distribution of Narcan was huge for the state.
Right.
I can tell you, my husband would be dead if we did not get free Narcan at an event at the Concord Hospital, where the posters for 211 Anytime Anywhere came out.
Yeah.
And they trained us, and I trained my children how to use it. My husband is one of those statistics. He fell 40 feet off a roof and lived through it.
Okay.
It was overprescribed OxyContin.
Yeah.
So my kids were trained at 12 and 16, to use Narcan.
Right.
And I was away from home. I remember it so clearly with General Welfare training at Head Start in Springfield, Mass. And I got the call that my husband had overdosed and my son had provided Narcan and that they were headed to the hospital.
Wow.
Yeah.
Yeah.
And I think about now, like, he's 2 years in recovery, volunteers at the Concord Coalition for the Homeless.
Yeah.
He works ironically as a kind of like a security guy for a bar in Laconia. But he's doing great, you know, and I think how different things would have been had my kids not had the tools to keep them alive that night.
Yeah.
You know, and in our populations that we work with, because I would say most of the recovery centers work mostly with people that are experiencing poverty, most chaotic use, you know, sometimes. That they can't afford to spend the money to buy Narcan at the pharmacy. And you would miss out on those stories like I just shared that, you know, from initiating recovery to being a homeowner, a taxpayer, an income earner, helping other people, working in the behavioral health system. Like, we would miss out on so much potential if we just let them die, you know, which is unfortunately some of the things that we've heard sometimes when it comes to the money being spent.
Yeah.
Can I just piggyback?
Yeah.
You know, this is sustainability of the funding is key. We cannot let up. And the Narcan distribution and awareness is something that we've worked on. And just last week, and it's not a good thing, I guess it's a good thing and a bad thing. We had one of our charter schools here in the city call and ask specifically for Narcan. And so we followed up.
Yeah.
And to your point, the staff needs to know how to use it. They need it on site. They need to start working with the youth about the addiction crisis and, you know, what is that all about instead of just keeping them inside. I think we have to not let up the gas at every level.
Yeah.
And we're a good example of prevention can be part of this solution. And initially, you wouldn't think that. Like, you think it's treatment and recovery, but also pulling when people are in recovery, giving them an option to help, as you say, to come around the corner and also work with the young people to make it is a scary thing, but I think knowledge is important, right? And knowing that there's a way that they can get help if they're having some kind of trauma right in their school. So that's the other thing I want to say is bringing the services to where they're at. That's what you're doing. One of the big things that we've encountered here in the city is transportation, right? When the kids had to go from the school to your office, it didn't happen. You brought it to them, and that's exactly what you're doing. And I'm seeing that at the Elliott, the is it CRMM or CRM?
Yeah.
And the doorway, they're combining, and they're all one-stop shop there for them, and they're starting to see success.
Yeah.
And I think that's one of the things that we learned, because I think at the beginning it's like you go here, or you go here. No.
Yeah. Well, especially in a state without a lot of public transportation, where a lot of the people you're dealing with are challenged with poverty, among other things, and that capacity to just be there. And I hear this from children all the time, you know, whether it's around addiction or mental health or just overall needing an adult in their corner. When we bring services to the kids, when we can embed a counselor in a school, it really, really makes a difference. I just met with 8th graders in Somersworth the other day. Well, sadly, their Gear Up grant has suddenly been pulled away, and so I was, you know, there to listen, but also to tell them not to give up, because you can't. But I think, you know, understanding the barriers that people have and not just blaming them for the fact that they exist is really, really important.
And one thing in schools too, the survey law, that has been like an impact for us, because we do run alternative peer groups in the Franklin School and Newfound School. In Newfound, it hasn't been an issue for us because we can put the release right in the suspension packets so that those get signed. But what we're finding is we can't survey the children for health information, so we can't do the GIFRs. Assessments that are required for our funding. We have the Building Communities of Recovery grant. And we're just lucky because we're also doing programming with DOC, and we're getting the 0 and the 6 months follow-up because they kind of can't go anywhere. You know? But for the youth, we have about 16 children that we serve that we don't get paid for at all. Because we can't do the Medicaid billing for them or anything. We can't survey them for the GIPRs, so we can't even put that into like the GIPR grant, you know.
And what does the GIPR stand for?
It's the government.
It's an acronym for.
Yeah, it's the assessment we have to do for the federal grants to show that we're making progress.
Okay,
You know,
got
so
it.
you're gonna do it at 0 and 6 months.
Yeah, and so, and is it because of school privacy laws or the?
It's because of the state law that passed that you can't survey children of health information within the schools without parental permission.
Oh, wow, okay.
So if the parents are not involved in, as the student, the counselors are telling us, yeah, those parents, they don't even sign permission slips for them to go on field trips.
Right.
So you're not gonna get the permission.
Right.
You know, that kind of thing. And so some of these children that have the most uninvolved parents or parents that are active in addiction, they're affected by the substance use disorder in the home, and yet, you know, we're working with them.
Yeah.
We are, but it's like we don't get credit for it, you
Right,
know, or
right.
whatever. That's been an issue,
Yeah.
the survey line.
And the survey tool is an important tool. I mean,
Yeah.
I mean, you also learn something from it. Yeah, yeah. That's a helpful thing to know, and I think it continues to be one of the challenges in public health generally, which is we all want to know what's going on in our kids' lives. Sometimes parent is just not going to be the person that kid confides in at that moment. Hopefully later in life they do again, but that's we want the kids to be safe, you know, and that's the first priority. And almost all of us have had an important adult in our lives who isn't a parent. But I'm sorry, you were going to say something.
Oh, I was just thinking we would rather them live.
Yeah, yeah.
You know, than not, especially if they're dabbling already.
Yeah.
You know,
Yeah.
and that's, you know, we were talking about the 7 challenges, one of the evidence-based programs that we will use, and
Yeah.
how important it is. But if it's because technically you can treat them, right, at 12 years and older, but for funding purposes, I think it's really difficult when you can't get the information you need to be able to do the billing or submit to the grants.
Okay.
So I don't know how you tell the people in Washington this, but we realize that not everyone's the same,
Yeah.
and not everybody responds the same. And so that makes it really wiggly when you're
Yeah.
trying to put a bill through or
Yeah.
to have a discussion, that it has to be a flexible and fluid approach that everyone is using in New Hampshire. Also, I think, no one's gone there yet, but I'll go there. The COVID epidemic was a stunning thing that kind of stopped us in our tracks.
Yeah.
But also put forth the trauma that young kids were going through, and it really needed to be addressed. Not only the young people, but also the caregivers around
Yeah.
them, or whoever that was or is for them. And I think that changed, how we started to work, because it's like, it's not, yes, it is the person that has an overdose or has addiction, but it's that family unit around them
Yeah.
that also has to have some supports, which everybody talked about today.
Yeah. No, I think that's a really good insight.
Yeah. So I don't know how you put that into words.
I mean, you know, that's why whenever you can, if there are stories, personal stories that strike you that are appropriate to share, that I can share about, you know, telling a family's experience. And the experience of the way support and intervention gets tailored or develops over time as you get to know the family better. Anytime you guys can help me with a narrative like that, as opposed to, you know, just talking abstractly, it definitely helps. And it especially helps me, sometimes the way this works is I'll say to a colleague from a different part of the country, hey, this is what I'm hearing about a couple of families in my state, or I've just heard from providers that they're having this particular challenge. Are you hearing the same thing? Sometimes they haven't asked the question or they don't, but if I can kind of just nudge them to go have the same conversation in their state, that's when we begin to, you know, have these conversations on the floor of the Senate or a committee where we're like, yeah, there's a universal need here and things happening, and we're hearing similar things from people on the front lines, and that just really helps kind of take it away from an abstract political discussion and much more into, you know, what do we need to do to help our families. absolutely.
Yeah, no, just kind of listening to you guys speak too, it's ending that second generational approach to trauma for our children that we're with. And,
Yeah.
you know, part of our SAMHSA grant that we received through the funding was being able to bring in early Head Start and home visitors. And I listened to you talk yesterday about the importance of family resource centers. And so we have a family resource worker that comes in a couple times a week and meets individually and does that group socialization, and also brings mom into that mix as well of, you know, the developmental milestones and how to help with, you know, just different things that this kid might be experiencing, whether due to trauma or substance exposure in the home, and really like that wraparound support all in one area. And I really love listening to you yesterday about your passion about the Family Resource Center, because they are, you know, really this backbone in our communities that free resources go in, and it has been really instrumental, and our women love it because they get hands-on experience that maybe they didn't have growing up for whatever, you know, different reasons, but has really been instrumental in helping bridge this connection. And we've seen it help reduce some of that like trauma later on in our kiddos too. But kind of going back to the point of things that we've learned as well, I always go back to like the Maslow's hierarchy of needs, right? That base level. Before that, you know, our women or, you know, population can achieve that next step is the basics of housing, food, safety, security. And so, you know, with some of our programs, we can't do a lot of it without housing. Great, we offer intensive outpatient programming, but if our women are experiencing homelessness or food insecurity or whatever it is, it's going to make it, or transportation barriers, it's going to make it really hard to show up for those services. And so it's been really great to receive some of that funding to expand our housing, you know, whether it's our low-income housing, our recovery housing, but really adding that to the mix of treatment really creates a strong foundation for them to take those next steps to achieve long-term recovery, you know, in addition to their medicated assisted treatment and, you know, some of these other resources. But, you know, just circling back, that parenting aspect is huge.
Yeah, we were honored yesterday at Nahatica's annual meeting.
Oh, cool.
Because our Family First program, which integrates family support and strengthening practice and peer recovery for these families that are young and parenting and have young children. We brought it to evidence-based finally after 3 years.
What's it called again? With
Family Threads.
Okay.
Yeah, which was exciting. Yeah, really exciting.
Cool.
Especially coming out of a recovery center, Cheryl Pacapelli was just like, I can't believe it.
Yeah.
She was so proud.
Well, it's these dreams that, you know, people have, and it's like coming to fruition, you know, and like you said, the work isn't done, but, you know, the ball's moving forward.
Yeah, still, yeah.
It's going.
Another federal issue, I think, is Medicare, and none of the treatment centers in New Hampshire taking it.
Yeah.
We just hit that area like every week.
Medicare as opposed to Medicaid.
Yeah.
The other thing too, we saw a lot of our recent emergency rooms and birthing centers closing in a lot of the hospitals is really putting a strain on, you know, and like bottlenecking some of those services because they're closed, and it's.
Let me go back to that transportation.
Yeah.
In the rural areas, I think
Yeah.
they're really going to
Yeah.
suffer. Because I know Health First just closed the clinic in Canaan because they just couldn't do it.
Yeah, and then Franconia is also, the clinic up there is closing. The staff is going to move, I think, to the Littleton clinic, but
Doesn't help people without transportation.
yeah, but and their director is trying to figure out the transportation piece for people, but you know, obviously that's an extra strain on a healthcare provider, and you know, it's a good healthcare provider, and they're going to do their best to figure out their way. But you know, I will say, look, we are in the middle of trying to figure out how to reverse some of the things that were passed as part of the big budget bill last spring, and the Medicaid cuts are significant. They're the biggest in history. I will just kind of say to all of you, when I talk to my Republican colleagues, they say it's just going to weed out fraud and abuse, and everybody's against fraud. Nobody likes it. The paperwork barriers that are being imposed are going to mean that people fall through the cracks. That is what I am hearing from providers everywhere. These are not fraudulent users. They are people who are struggling or who may be getting treatment when their renewal paperwork arrives, may not have permanent addresses. But the impact is going to be that providers have less and less reimbursement for their care. And I'll also just let you know that the Department of Health and Human Services fired its Inspector General, who had recovered $400 million in 2024 from a so-called medical equipment provider that was falsely billing. That's the type of wide-scale fraud we should be going after. And so we are pushing back on our colleagues on the other side of the aisle, some of whom, as you know, didn't vote for that bill because they had talked to their healthcare providers in their states and realized that it was going to be devastating. But we are, overall, rural healthcare is been cut by $100 billion. They've cut $150 billion and then put $50 billion back in, but that's still a $100 billion deficit. And then the other significant problem is that the Affordable Care Act advanced premium tax credits have not been extended. They expire at the end of this year. And part of the reason we're having this budget standoff at the moment, which I'm trying to encourage everybody to keep talking, is that as of November 1st, insurance companies are going to start issuing new premium rates. And if they don't know that those tax credits are extended, the rates people are going to be seeing are, for Affordable Care Act premiums, are increasing astronomically. Like a 60-year-old couple in New Hampshire earning $85,000 a year are going to see, the latest estimates are an increase of $14,000 for their health care. And what that means is just more and more people aren't going to be able to afford the health care on the marketplace. The only people who will stay on are people who have health challenges, so they know they can't go without health insurance. So we are trying really hard to get, commitments because our Republican colleagues tell us, at least some of them do want to extend those tax credits. They understand that people can't afford these huge tax increases, these huge premium increases. But the timing matters here, and the more we cut health care, the more it will drive up expenses for everybody in the commercial market, regardless of where they get their insurance. So just so you know, that is part of the backdrop right now of what we're trying to protect I want Medicaid in schools for kids with special needs to continue. I want people who are struggling to take that first step in recovery and build a better life to be able to get coverage and then move on to private coverage when they've got a job and they don't need to be on Medicaid anymore. But that is part of the backdrop here, and we are very concerned about what we're hearing in terms of rural emergency rooms closing. Labor and deliveries already we're seeing closing. There's good bipartisan work. We're trying to get some bills through to help, and that's something where the women of the Senate in a bipartisan way are trying really hard to address that because it's such a priority. But that's the other piece of this. The Support Act is really important, and this is going to authorize funding that you guys have done so much work to kind of show the evidence for, which is really exciting. But we got to take care of the other part of our healthcare system too, so that we're not just devastating one part of the system while putting some money into the other, because it's, to your point, comprehensive too. People have healthcare needs, some of which may be addiction, but some of the reason we know people may have addiction is because of other underlying healthcare issues, or in your husband's case,
Yeah, so many hip surgeries.
Oh, I know. I mean, as somebody who has a family member who's had a ton of orthopedic surgeries, how you manage that is really, really hard, and you need to be able to manage the whole person.
Yeah.
Allison is standing up, moving around, which tends to mean she wants me to wrap things up. Anything we didn't discuss? One of the things I really want to let you guys know is just not only how impactful your work is, but how inspirational it is. Because think about where we were 10, 15 years ago as a state, and
Not a good place.
not a good
I was in
place.
the basement of a church volunteering, doing
Yeah.
this stuff.
I mean, I am still remembering the funeral I went to where the young woman who had been lost was the second child her parents had lost to addiction, I remember being in a church, listening to a woman who figured out her way through recovery without going into inpatient treatment because she had a job cleaning houses and she had kids at home, and she just, how she did that to this day, just like, is amazing to me. So, you know, and frankly, I remember talking to a lot of first responders just in complete despair because they kept going back to the same home, kept responding to overdoses, and they couldn't do anything to help. And they just, and that's how, Safe Stations got started, right? So as hard as it has been and continues to be, and, the second generation impacts are something we all got to think about, just know that your work and your commitment and your care has just made a huge difference for our state and now our country, because we have some of the best examples of what works coming out of our small state. And it's a real gift to be able to share that with the rest of the country and know that, there's light there. We gotta keep moving towards it. Anything else you want me to know, think about? You all know how to reach me or reach Allison and the office, right? Thank you again for taking the time. Happy Friday. Yeah.
You have a timekeeper?
Yeah.
Yeah.
Yeah, they have.